Hi, my name's Dan, and I'm a flight paramedic in the Philadelphia region.
Good morning, good afternoon, and good evening. Thank you for joining me on another episode of Shared Stories of Medicine. For the first episode, my introductory episode, I had the fortune of speaking with Astro, the paramedic. For this episode, we are going 10,000 feet into the sky to talk with Dan here, the flight paramedic. Is it 10,000 feet? Is that how high helicopters fly? I'm actually not sure. That was a rough guess.
We're probably going to be looking at around 1,500 around this area.
Okay, I gotcha. All right, well, numbers aside, we have Dan here. He's going to tell us all about being a flight paramedic, and I think one of the big distinctions is not only training but also operations and what you do in your day-to-day. So, if you wouldn't mind elaborating on just the differences between a street paramedic and a flight paramedic, and that can be, additional certification or training, because people already know the educational part of what it takes to become a street paramedic, but maybe elaborate what it takes to go beyond that to become a flight paramedic.
Sure. So here in the United States, things vary a little bit from state to state, as each state's health department is sort of responsible for their own regulations. And I really only know Pennsylvania and New Jersey to a smaller aspect because I sort of work on the border there.
Right.
But essentially, a sort of so-called street paramedic or like a 911 paramedic who might show up to your 911 call will have one scope of practice, and then the state in this area recognize a critical care transport paramedic as a different level of care, and these are typically paramedics that are called upon to transport people from hospital to hospital. So a flight paramedic is sort of more in that vein of scope of practice, where we will be able to do all the same things as your 911 or street paramedic can, but then we also have to be able to transport patients, say, between hospitals who might be from an ICU and maybe have some medication infusions or maybe on a ventilator and stuff like that. So those are things that a typical 911 paramedic doesn't really need to learn for their emergency practice, but these are things that a flight paramedic would learn. And then obviously there's also, just the logistical differences of treating a patient in a helicopter versus driving down the street.
Right. Yeah, all things to take into consideration. Now, when you say critical care, I'm assuming that this is an additional certification over your paramedic certification. To become a flight medic, you just get critical care certified, or how does that work?
Yeah, and sorry, please stop me if I start using too much jargon or industry speak that I should be explaining a little bit further. But
no worries.
Yes. Critical care, is sort of a blanket term, which essentially means I guess sort of ICU level care and intensive care, certain types of medications, and generally for your more critical or more unstable patients that require sort of higher levels of attention and more advanced care methodologies. So there are multiple different certifications. There's to be like a regular 911 paramedic responding to emergency calls, you need to get certified by the state and also at the national level. And so all paramedics in Pennsylvania are certified with the National Registry of Paramedics, as well as with the Pennsylvania Department of Health. The flight paramedics are not like their certifications are not really recognized or required by the state, but it's more like individual employers will generally require you to have a quote unquote critical care certification. One of the most common or popular ones would be the FPC, which stands for Flight Paramedic Certified.
Gotcha.
That is what I have, and I will tell you, it was probably the most difficult exam I ever had to take.
Yeah, a lot of focus on critical care is what it sounds like, and definitely some flight aspects to take into consideration as well. I mean, did you hit on like any physics or anything like that during your testing?
Yeah, there is. It was not incredibly high level stuff. I mean, it was basically a review of what I recalled from high school, or I should say what I did not recall from high school, and physics and chemistry.
I gotcha.
But yeah, there was some of that.
Boyle's
like I said,
law
nothing
and
too
whatnot.
complicated. Yeah, Boyle's law,
Yeah.
Henry's law, Dalton's law, exactly.
Gotcha.
But names that I remember, but I don't remember what they actually mean. So I had to kind of go back and study that stuff. But it's not complicated.
Very cool. So, what does the flight crew itself consist of? What are the team members on your crew? Because on the ground, I know Astra spoke about, it's paramedic on a MICU, or it can be paramedic EMT. So, what is the flight crew?
Yes. So, typically on the ground, like you said, you'll have two paramedics working together, or a paramedic and an EMT, or you could have two EMTs. For flight EMS, helicopter EMS, we typically, at least in this area, we typically see a nurse and a paramedic. Now, both the nurse and the paramedic have to have additional certifications. Like we just talked about the flight paramedic certification. Well, the nurse has to get a special flight nurse certification as well, and the nurse also has to get a what's called a PHRN, pre-hospital registered nurse certification, which is essentially the nurse learning how to be a paramedic, because.
Right.
Because in addition to these inter-hospital critical care transports, we also do respond to 911 calls, and although nurses may know more in general about medicine than paramedics, they typically do not have to learn the same type of methodologies in terms of responding to emergency calls as paramedics. They're more, more focused on, in-hospital
controlled environment versus
exactly.
nitty-gritty, pre-hospital emergency medicine.
Yes. So essentially, when I became a flight paramedic, I had to learn how to become a nurse, and when a nurse becomes a flight nurse, they have to learn how to become a paramedic.
Gotcha. Very cool. A little bit off topic, but are the pilots of the helicopters typically certified through secondary education, a university, or are you seeing a lot of military veterans, moving on to becoming a civilian pilot, or how does that work exactly? Do you know?
So I can say I can only really speak to the program that I've worked in, but the majority of the pilots are ex-military.
Yeah.
Most of the hospitals, if not, I believe all of the hospitals in this region, they do not own their own helicopters. They contract out with a company that does flight medicine, and so essentially there's several different companies around the region and around the country, but the company essentially will supply the helicopter and the pilot and the mechanic and do all the maintenance, and then the hospital who contracts with them will supply the medical crew and oversee the medical aspect of things, and it's sort of a partnership in that aspect. Now, the pilots, like I said, many of them are ex-military, but not all of them. What they are required to do is there's, just like we have to have our certifications, they have to have their helicopter pilot's license, but they also have to have a certain number of hours, which I believe is over 1,000.
Probably a lot, yeah.
Flight hours, which is a lot when you think about it. And,
for sure.
And then they also they have to have a certain number of hours in that specific type of airframe that they're going to be flying. And I believe they go for what's called a check ride every year, where they ride with an instructor, or they fly with an instructor, and they pilot the aircraft, and the instructor puts them through different scenarios and evaluates how they respond.
Are they medically trained at all? The pilots?
They are not. No, actually, so I think there used to be more overlap back in the day, but they may or may not have some medical training from their background, but it would be only incidental to their job. We actually don't really want them to be involved in patient care, because flying a helicopter is really such a complicated and dangerous job to do by itself. So, and the consequences of screwing it up are quite dire. So
requires all of their attention.
Yeah, we want them to only be focusing on flying the helicopter and getting us from point A to point B safely, and really not worrying about anything that's going on with the patient.
That makes sense. I was always curious if if you ever needed a helping hand in a certain situation, if they were capable of jumping in.
No, I mean,
any kind of formal training.
The most they really typically do for us is like help us, carry things, or help us load the patient into the aircraft. But no, and we typically have more than enough help anyway. If you think about, if there's a helicopter landing at an emergency scene somewhere, there's not just going to be like 3 people there. There's going to be the entire fire department, several police vehicles, probably at least 1 ambulance. There's going to be more help than we need.
For sure, yeah. Now, you mentioned you do interfacility calls where you're going from hospital to hospital. I assume sometimes this is a transfer to higher level of care if there's, the hospital you're transferring from doesn't have the equipment or the skills or the staff available for whatever intervention. But as you mentioned 911 calls, I think, what do the logistics look like for a 911 call in a helicopter? I mean, in my mind, the aviators go on, Kenny Loggins, Danger Zone, Top Gun music plays. You guys walk in slow motion to the helicopter, and you board it and do a barrel
there's
roll.
A little bit of a breeze and our scarves flying in the wind. Yeah,
that is what I picture in my mind, but I'm sure there's at least maybe 1 or 2 things incorrect there.
Yeah, so I guess first of all, I will say that the first couple times I did kind of feel like that, but very quickly it just became my job. So
but it's so cool.
Then I just sort of be dragging my feet out there, going, "Oh, okay, we got another one."
Yeah.
But it is still fun and exciting. And
absolutely.
But
when you get a 911 call, what does it look like? Like, what is the procedure? The call comes in, you got to gear up, get to the hospital, or get to the helicopter. I mean, like, what happens?
Sure. So again, in Pennsylvania here, things are divided up by county. I do work in New Jersey a little bit, but I don't understand their system as much. Cool. So I'll kind of just focus on the way it is here in PA. But essentially, each county operates a 911 dispatch center. And when you call 911 and you tell them there's like a medical emergency, you will they will dispatch an ambulance and sort of feed that information out to the ambulance and dispatch other appropriate resources as necessary. Often the police will also come to the call, although not all the time.
Right.
So when they never just, I shouldn't say never, they generally do not dispatch a helicopter just from the initial call. What they will do is send an ambulance. The ambulance will arrive on scene. The paramedics will evaluate the patient, and they will call over the radio to the county dispatch and ask for a helicopter.
Gotcha.
And then what will happen is the county dispatch center has a list of, they'll use the address of the incident, and they have a list of all the closest, second closest, third closest helicopters, and they'll call the closest available one, and they'll be dispatched to the scene, and they'll just give us GPS coordinates, and we'll program that into our flight computer, and that'll help us navigate there.
Is there a whole, sorry to cut you off, is there...
of course.
I think about when I took my motorcycle license test, they really emphasized doing like a once around of your motorcycle and making sure everything's in working order. Is there something similar for the helicopter?
Oh yeah.
Pretty in depth, I imagine.
Yeah, we have a so we have a full-time helicopter mechanic who is assigned to us, and just to this one aircraft. Now, I will say he does other ancillary duties like helping work on other aircraft and stuff, but the majority of his 40 hours a week are spent just doing inspections and preventative maintenance on one helicopter, which is the one that we're flying.
That's awesome.
So there's that, which makes me feel pretty safe.
Yeah.
There's each pilot does a 12-hour shift, and we're operating 24/7. So one pilot will be on for 12 hours for the day shift, and he'll hand off to a night shift pilot for 12 hours, and so on and so forth. Every single time the pilot comes in for his 12-hour shift, he has a whole checklist and series of checks. He opens up all the cowlings around the sides and looks into the engine and into the intake ports and so on and so forth, and is checking for all sorts of things. They'll take a fuel sample out to make sure the fuel hasn't been contaminated by water or rust or something like that. So yeah, it's pretty involved, and they do this every 12 hours when they come in for a shift. And then in addition to that, we as the medical crew, every time we are going to take off to go somewhere, one of the crew members, after the pilot has started both engines up and gotten all the rotor blades spinning and everything, either myself or my partner will do a quick walk around the perimeter of the aircraft and just be looking for anything that's out of place, any fluids dripping out, any smoke coming out anywhere, anything that's out of the ordinary at all. So that's every time we lift to go anywhere.
Yeah, I mean, that's huge, right? Because you don't do anybody any good if you crash on the way there. And I think a lot of people have been focused on helicopter safety, especially with recent news like Kobe, their helicopter crashing into the side of the mountain. So that makes me think, it's pretty high risk. So that kind of safety check is absolutely instrumental. Now, do you get hazard pay or any additional stipends on top of your regular pay to be on the helicopter? How does that work?
So no, we don't really. We get paid approximately the middle range of middle to upper range of paramedics in the region. I don't have official numbers, but I would say I definitely know some medics who just work on an ambulance on the street who make more than I do. I know some that make less. There's definitely not a premium. I think I kind of feel like the thinking is that, well, this is such a cool job. You want to do it so badly. We don't need to pay you more.
Right. It's a sought after position.
Yeah. Which I guess there are arguments on both sides about that.
Sure.
I do agree that it's a cool job and it is a sought after position. And on the flip side, I think you do need to offer enough money to make it worth it for the best and the brightest people to want to come do this job. Because, let's face it, in every profession, my dad always used to tell me this joke. What do you call the guy who finished last in his medical school?
A doctor.
Yeah. So, there's some paramedics at the bottom of the spectrum, and there's some at the top. And I think when you're going to talk about having them do more advanced levels of care and putting them in a helicopter on top of it, you kind of want to get the people at the top end of the spectrum in there, and
there has to be
offer a financial incentive for that.
Yeah, there has to be standards, because this is not only, as you described, intensive critical care happening in a close environment, but you're also doing it, I'm sure my numbers are off, 10,000 feet in the air, like I said earlier, and helicopters alone are just inherently dangerous. So it's kind of shocking that they don't have any kind of hazard pay or incentive or anything like that. Do they make any strides to improve safety for you guys?
So we do have a lot of systems in place to address safety issues, more so than I think I've seen in other EMS jobs that I've worked. And I think part of these are that there are different accreditation standards that we have, like for non-medical people, this might not make too much sense, but if you've ever worked in a hospital, you know what JACO or the Joint Commission is.
Right.
And they're essentially an accreditation standard, which although not required by law or anything, it's essentially nobody wants you around. Nobody wants to call you for a transport if you don't have this accreditation. Everybody sort of voluntarily gets it. And sure. These accreditation standards require you to have things like a safety committee that meets on a regular basis and makes recommendations, have a safety reporting system, both anonymous and not anonymous. Different things like that. And they also have like specific protocols, or what's the word I'm thinking of? Policies in place that address things. For one example, there was a problem, I guess I want to say back in the 80s, maybe 90s, where essentially people who needed a helicopter would call the first one, and they would say, no, the weather's too bad, we can't do it. So they'll call the second one, and they'll say, no, the weather's too bad, we can't do it. And then they'll keep calling until they find someone who's desperate enough or cocky enough to take the job. And so that is no longer, or one of the mitigating factors that they use for that now is if anyone has turned down the job for a weather-related reason, or for anything else really, if they call the second person, which might be in a different location, and maybe he can do it, maybe the weather's not a factor for him, but they have to tell him, helicopter A declined this for weather, helicopter B declined this for weather, your helicopter C. So, maybe the pilot for helicopter C is going to take a harder look and be like, you know what, if those two guys didn't think it was safe, maybe I shouldn't go either.
And that brings up an interesting point. Actually, I should say a question to mind. You turn down flights. So if somebody has an emergency, let's say interfacility aside, there's a 911 call and there's inclement weather, and they call you, who's the ultimate authority on whether or not that call is taken by the crew or turned down? So
we have let's go to a saying that we say, we have a 3-person crew, typically a pilot, a nurse, and a paramedic. And we say it takes 3 to go and 1 to say no.
Gotcha.
So that means all 3 of us have to say yes, that we feel comfortable taking this. And if one of us, for any reason, says, no, I don't feel comfortable doing this, then it's supposed to be no questions asked. We decline it.
I like that. 3 to go, 1 to no. What was it again?
3 to go, 1 to say no.
1 to say no. I like that.
Yep.
I like that a lot.
Yeah. So obviously, it would be frowned upon if we abuse the situation. If I just said, well, I'm going to say no because I'm tired and it's almost the end of my shift, and too bad for that patient. But
yeah,
if I look outside and there's a thunderstorm and for some reason the other two people in the crew think that it's going to be okay, I might say, guys, I'm not really okay with this.
And you get I imagine there's some sort of access to a current weather feed, something beyond just streaming the weather channel in your station. Is there you have like Doppler, or how does that work exactly? You have a weather balloon?
Yeah, we're not just watching the local weather guy with the bow tie that we have here in Philly, whatever his name is, Glenn Hurricane Schwartz. That's him. No, so. The pilots have some specific applications that they use on the computer, and I don't really know exactly what they are. One of the things we more or less rely on the pilots to be more experts on the weather than we are, but that's not to say I don't also take a look.
Right.
So
it's interesting.
I don't understand. They actually have a little bit of an education in meteorology, at least the basics.
Yeah.
Whereas what I will do, which is something I can understand a little bit better, there's actually a website, I think it's aviationweather.gov, that the U.S. government runs, and it will show you, among other things, every airport has like a little weather station, and they report weather data on a periodic period of things like how high the cloud level is above their station, what the winds are in what direction, if it's like raining or snowing or whatever.
That's really nice.
So so I can look at that and say, so this airport over here has a 2,000 foot ceiling, and then this airport over here is reporting a 5,000 foot ceiling. So, those are kind of marginal conditions for us, because if that 2,000 foot ceiling gets any lower, then we might be flying into clouds and we can't see all of a sudden.
Sticky situation, yeah. Now, all of the things that you mentioned, I could probably answer this question for you. I can think of 10 different things, but what are some of the biggest challenges that flight paramedics face? Maybe you individually or other flight paramedics. What's something really challenging about being a flight paramedic?
Oh, well, I guess one of the challenges is finding enough stuff to do with all of our downtime.
Yeah.
But no, I kind of joke about that. But
you can only polish your helmet so many times, right?
Exactly. Yeah, we still have to come to work just to get everything ready, and then sit around and wait for a call.
Hurry up and wait.
Now, I'm not complaining about that. I actually quite like doing nothing, and I'm very good at it. I often study the backs of my eyelids.
Right.
But no, in all seriousness, I think the biggest challenge, I would say, is logistics.
Yeah.
We are transporting patients in a very tiny space. The inside of the helicopter is much smaller than most people realize. And in order to make a machine that can lift a patient on a stretcher and a couple of people sitting beside them, like, the machine has to be pretty large already. If you're going to have, say, if you think about like Marine One, the presidential helicopter, that thing is monstrous. It can't land on the roofs of like most rooftop helipads, like at a hospital, for example, because it's way too big for that.
Right.
Not to mention, it probably costs like $100,000 a minute to fly it. But
super expensive.
So our aircraft is very, very small, and most medical transport helicopters are typically very small. So there's just enough room for a patient, a little bit of equipment, and me and my partner in the back there, and not much else. So when the patient is on all this like complicated ICU equipment, like a heart and lung bypass machine or something like that, and they have all these tubes and drips, medications, and ventilator, breathing tube, everything coming out of them all over the place, getting them loaded and unloaded without getting all that stuff tangled or dislodged is quite challenging.
Yeah. Do you transport ECMO patients?
We do, in fact.
Wow.
Yeah, we used to take a physician and a perfusionist, who's like a person who operates the ECMO machine, which is like a heart and lung bypass machine.
Right.
Yeah, now we are actually just transporting just the perfusionist who operates the machine, and then we, as the paramedic and the nurse, handle all other aspects of patient care.
What does the cooperation look like when you go to pick up these critically ill people in the ICU? Are you showing up, getting a report, stabilizing the patient, like untangling everything, getting everything? Like, I imagine it takes a while, right?
So that's a good question. There's a pretty big spectrum there, I have to say. So we have a wide range of calls that we do from the hospital to hospital. For example, fairly frequent type of call for us is a patient comes to the hospital and they find out he's having a heart attack or a stroke. And typically there's not a huge amount of care that needs to be done for these patients in the ER, but they need to go to a specialty center to have a special procedure done to remove that blood clot from either their heart or their brain.
Right.
So it's a time-sensitive emergency. So often, if it's a long drive to one of these hospitals, they'll and most small hospitals don't have this capability because it's a fairly advanced procedure. So they have to go to a larger, city hospital.
Yeah.
So like for those, it's pretty quick and easy. They usually don't have a whole lot going on. We just we're in and out in less than 10 minutes most of the time. We just pick them up. If they're on any medications, we transfer them over. We put them on our cardiac monitor, and we get a very quick, bare bones report from the nurse or the doctor in the ER there, and we just get out of there.
Just stabilize them, just keep them stable along the way.
Yeah. We, we'll provide any care that needs to be provided. And we, for the most part, we can do most of the same things that a small ER can.
Sure.
Anyway, so, we just know that the patient ultimately needs to get to where they're going to get the definitive care. Now, contrast that with, we might show up in the ICU and the patient's been there for a month already, and they decide for whatever reason they need to be transferred to another hospital, maybe for a special surgery or some sort of procedure that they can't do at the one.
Right.
And they're on like 5 different medication drips, and they're intubated on a ventilator, and there's all this stuff. So then sometimes we'll get some help from the sending team. Sometimes they don't really want much to do with us at all. And I'm frankly completely fine with doing everything myself, but just me and my partner, we typically work well together. But if we're getting help from the hospital, that's great. And sometimes they are really great, and sometimes they are really helpful. And I mean, sometimes we show up and there's still care ongoing, especially in the emergency department. Maybe the patient only got there half an hour ago, and so we'll
it becomes a coordinated team effort to get them ready for the
exactly.
flight.
We'll just be an extra set of hands working with the ER staff to sort of provide care to stabilize the patient, and we might be consulting with the sending doctor over what parameters they want to try and maintain, and maybe he'll make some suggestions for us, like if this happens, then maybe try this.
And I imagine if the flight nurse on your crew comes from an emergency department or ICU background, they're probably a great help in frustrating situations like that. Maybe they can level with the person a little better. Like, hey, I did this job too, or I don't know how that works out, but it seems like a good crew member to have.
Yeah, I mean, just having general interpersonal skills, I think, is a good thing that anyone can really do.
For sure.
There's definitely there's definitely situations where, adrenaline's pumping and people have strong opinions and maybe, don't really feel like there's time for courtesy or whatnot or pleasantries.
There's just no time.
It's just important to be able to sort of keep a level head no matter what's going on.
Which is silly because it should be a coordinated team effort. It should be an open forum discussion always. And I don't think there's really any room to be socially inept in any facet of medicine, especially one where there's critically ill people that need a I will say,
99.9% of the time, we're not butting heads with anyone. We're,
right.
We're being treated courteously and we're treating the other staff that we're working with courteously. It's,
everybody's on board. Nice coordinated effort. The way it should be.
Well, I'm not going to say that everybody's always on board, but, for the most part, everybody's pretty nice.
Yeah, the majority of the time.
Yeah.
So one of the questions I like to ask guests that come on to the podcast is in the age of COVID-19, and there's a lot to be said by Astro, the street paramedic, but how has COVID-19 or just the pandemic itself affected your job? Have things changed significantly, or is there any notable things that you can point out?
Well, first, I just want to preface by saying that I was fortunate enough to have gone out on a temporary disability that was like a planned surgery just before the pandemic started.
Right.
So I kind of missed the beginning part of it, which where we sort of didn't really understand very much about the virus, didn't really necessarily have the proper PPE available because everyone was trying to, buy it all up all of a sudden, all at once.
Yeah.
And like, we didn't really understand what precautions we even needed to take because it was just so new.
It was just rapidly evolving. Yeah.
Yeah. So I sort of missed all of that part. So I can't speak too much to it. I sort of came back to work after we had sort of developed some systems and gotten our stock back in order and sort of developed policies and procedures around it and everything. So it was a lot less chaotic for me just coming into it. But I think some of the biggest challenges are just I did listen to Astro, and I really was shaking my head yes when he was saying some of those things. And I also work 911 on an ambulance part-time, so right. I deal with that sort of thing as well. But just showing up to some sort of emergency or some sort of like thing where that this is a time-sensitive issue that you need to get this patient from point A to point B, but you still have to pause and put on like 2 pairs of gloves and a gown and your face mask and your eye protection. And,
your safety comes first. It's no different than your pre-flight check that you were talking about.
Yeah, of course. But it is still difficult to, cause you just want to go and do your job. But now there's just this extra layer of stuff that you have to do, in order to do your job. There's other minor things like I'm glad it's the winter right now, but wearing that stuff in the summertime is terrible. I mean, it's when it's 90 degrees outside and you're like the gowns that we have to wear are essentially like one of those plastic sweatsuits that you see like guys who are trying to lose weight for wrestling or whatever. It's kind of brutal wearing it when it's really hot out. It's fine when it's cold right now.
The helmet alone, I imagine the helmet alone, does that ever fog up? If you're
you know what? Bullets? I didn't even think of that, but that is one. We have this visor that shades down over the front of the helmet that we have to wear, and essentially, if your helmet is cold because it's been sitting in the aircraft on a cold winter day while you're picking the patient up, and you come back and put your helmet on, now your visor's cold. You breathe out through your mask. One or two breaths, less than a minute after I put my helmet on, I basically can't see anything
just
anymore.
Zero visibility.
Yeah.
That's horrible.
And the same, I'm at least looking forward to being able to see in the summer.
Yeah, seriously. You'll be able to see in the summer, but also I think about the helmet and just how much heat, I know me personally, when I'm riding my motorcycle, in the summertime, there's so much heat inside of that helmet because I have the full face that it's really easy to get sweaty really fast. And I don't know, it seems uncomfortable to pull up to a job and be sweating bullets.
Yeah. And, we do have air conditioning in the aircraft and we do have heat as well, but it's, I'll say it's not terrible in the wintertime. It's a little bit cold, but in the summertime, it is hot. I mean, we, the thing sits on the helipad and just like baking in the sun and, say it's like a 90-degree day and it's having the sun shining on it. And then we start it up, and if you think about when you get in your car on a hot day when it's really hot, how long it takes your car to cool down when you turn your air conditioner on. Well, by the time it started to cool down in there, we're at the end of the flight.
And the flight suits are a onesie, right? There's no room for ventilation. There's no short sleeves
or shorts in the summertime either.
So you're not allowed to go sleeveless on the helicopter, is what I'm hearing. You can't get
I think I might try cutting them off and showing off the guns to see what happens. But I think that might be frowned upon.
A doctor's note or whatever. You could look like Todd from Scrubs, the doctor always wearing sleeveless scrubs. Yeah. So this brings me to another question. I mentioned earlier that when you get a call, my mind immediately goes to Top Gun. Like, it has to be awesome. It has to be like really cool, and everything that you do is in slow motion until you get to the call itself. But outside of that, Kenny Loggins fueled misconception. Are there any other myths or misconceptions about flight paramedics to dispel? I can't think of any outside of the Top Gun reference.
There's got to be something. Let me see. I do sometimes feel like people think that we're smarter than we are, but
I gotcha.
Maybe I'm not giving myself enough credit. No. One of the things that shocks me a lot, I wouldn't say this is really a myth so much, but people don't seem to understand that when the point of the helicopter is speed. Like, so when a hospital calls and says we need a helicopter to transport this patient, this is emergency transport, they by the time they've called into our like hospital transfer center, they immediately call us and tell us like, okay, go to this hospital. We go out and start moving without really knowing what's going on because we just want to get the ball rolling, and then we'll get more information say on the way there about what's happening. So by the time they've made that call, but within like 5 minutes after they've made that phone call, we're already out the door. And 5 to 10 minutes after that, we are lifting off the pad. And, depending on how long it takes, it only takes like 5 to 15 minutes to fly to most of our destinations in this area. So,
sure.
So we get there and they're like, you guys, how'd you guys get here so fast? You guys got here so fast. We don't have anything ready. We weren't expecting you for an hour. I'm like, it's not like we got stuck in traffic,
We flew here.
Yeah.
We bypassed all that.
Yes. I can't specifically think of any myths. I'm sure as soon as I get off with you, I'll think of something and be calling you back. But
yeah, I'm sure. Rich had a lot to mention about DPTs, and I think that mainly stems from the fact that not many people even know what the abbreviation stands for. So when they hear it, their mind immediately goes to several iterations of like far less trained professionals than what a doctor of physical therapy is. But you say flight paramedic and most people know what you're referencing. I know there's varying degrees of flight paramedics depending on what country you're in. But people usually have a pretty good idea of what you do. And
yeah, I will say that, and again, I don't know if this is necessarily a myth, but a lot of people don't think that that we're able to do the things that we can do. I get a lot of, we show up and the patient's on all sorts of equipment in the ICU or whatever, and like the nurse or the doctor are sort of going like, all right, we'll have to discontinue this for you guys, or we'll like give me a minute so I can like pull this out, or give me a minute so I can connect this for you. And we kind of have to just gently tell them like, we're familiar with all of this equipment and all these medications. We do this all the time. We can handle it.
You're an autonomous clinician, both you and the flight nurse.
Yeah. The idea is essentially to sort of bring the, we work for a major teaching hospital. It's a level 1 trauma center and everything. And then the idea behind these flight programs from these prestigious institutions is to bring the level of care of that hospital to the bedside anywhere. So we may not be able to do the specialty procedures that require, specialty doctors and equipment and everything, but we can bring that level of like critical care, ICU level care to the bedside, even if you're at a small clinic in the middle of the boonies, as long as you have a flat place for us to land somewhere nearby.
So for anybody listening that wants to be as cool as you or Tom Cruise, not that he was a flight paramedic, but I mean, come on, he was pretty badass. And
no, but I've done a barrel roll or two in my day.
Yeah, exactly. Anybody that wants to become a flight paramedic, do you have any words of wisdom you would like to pass on?
Sure. So, I guess the first thing I would say is, do things in order. So, get your basics down. You don't want to just go to school, become an EMT, go immediately back to school, become a paramedic, and then immediately try to get into, flight paramedicine, critical care transport. I actually attempted to do that myself in my career, and I applied for the job I am working at now, and they said, no thanks, you just got out of paramedic school.
Right.
We want you to go work for a 911 squad for a couple of years at least, and learn how to do that.
Get your feet wet.
Get your feet wet doing 911 calls, emergency medicine, and then when you feel like you're ready, come back. I think they told me at least 1 year. I think I stayed out for 5 before I came back and applied. And by then I was kind of happy doing or at least for the first little while, I was pretty happy doing 911, but I just wanted to, eventually wanted to come back and get like a little bit more of a challenge and learn a little bit more. Now, the other thing I will say is just if you are a EMT or a paramedic and you're working that 911 job and getting that experience, you probably are also spending a lot of time sitting at the station waiting for calls to happen.
Sure.
So a lot of people will choose to use that time to study the backs of their eyelids or see how many times they can watch the same movie over and over again on Netflix. I would suggest to those people to take. It's important to take some time out of your day when you're in your downtime period to rest and relax, but also spend some of that time learning, even if it's just an hour a day. Just pick something to read, pick something to learn, and when you're taking your patient into the hospital and you drop them off somewhere, ask the doctor a question if you can think of a question to ask. It's as simple as that, and you'll be surprised by how much. Yeah, exactly. Always be advocating for your own education.
Constantly study. There's so much research being done, and like I said, every facet of medicine, there's always research to be done and things to be learned. So I think that's sound advice. So do your stuff in order. Get your feet wet, get some experience. Don't rush things, and use your time wisely. Use your downtime to learn. Always be learning. I think that's smart.
Yeah, and it is. It's interesting, Tim, and I know you know this, but I think most people don't. I was very surprised when I first got into this field. But emergency medicine is a very young field. We are. Many of the practices that we are implementing are things that were, just based on studies that were just done a few years ago. Or, in the short, I've been in EMS for about 10 years, and in that period of time, I have seen the practice evolve. So many of the things that they told us to do when I first got in are now completely changed. A study comes out next year and maybe it'll change back again. So it's really an evolving field. So
it's all
another
under
reason
a
to stay on your
microscope.
toes.
It is very fresh from what I understand, especially the pre-hospital aspect of things. I think that was developed post-Vietnam War. I think there was like a white paper or something developed that had mentioned you're more likely to die. What was it? You're more likely to die in a crash on a California highway than at war. It was some like ridiculous statistic that the lack of pre-hospital emergency medical services was apparent, and people were noticing just the high mortality and morbidity. So it's ever evolving for sure.
Yeah. If you think about that show, what was that? Emergency, where
the old one. Yeah,
in the 70s, that was a pretty novel system for them, and a lot of places didn't have anything. Or at best, like you maybe the fire department or the police would come like scrape your body up off the sidewalk and throw you in the back of the car and drive you to the hospital.
That was
a lot of hospitals didn't really even have emergency rooms as we know them now.
Yeah, that was it. Just hope for the best. Scoop them up and hope for the best. I think those are all good words of wisdom. Hopefully some people that listen to this can, take the appropriate steps and become an awesome flight nurse, flight paramedic. Maybe they'll work with you. Maybe you'll have to train them in, however many years it is that they get on the helicopter. Maybe they'll get to work with you. But thank you so much for being on. I really appreciate it. And I will talk to you later.
Thank you very much for having me.
All right, I'll see you.